Hey there, it's Seth Myers of Sinus Spine Sport and Rehab, and today we're going to go over a drill that I often give patients who are dealing with low back pain, who especially get more pain with bending forward. Most people that I see as they bend forward, what they'll do with their upper body is they will bend forward, but that puts their center of gravity kind of out in front of where their feet are. And so what we want to work on is something called a hip hinge, where we let those hips take most of that load, and it keeps our center of gravity or center of mass kind of back where our feet are, so that low back isn't getting quite as much load and torque. So Matt's going to help us demonstrate. Typically, to start with, what we want to do is I'll give this to him. If we were to stand up nice and tall to start this drill, or if you're standing up nice and tall before you bend forward, is we want to have the tailbone, mid-back, and the back of the head touching like a straight line before we would start this drill. So that's just a visualization. So we're not going to hold that there while we do this drill. But before you start this drill, think about being nice and tall and upright. And the way that we do this drill is standing just in front of a wall like so. We can let the knees be nice and soft. And we're just going to push those hips backwards. So as he pushes those hips backwards, that upper body should almost naturally just kind of fold forward slightly. And so once you've done this a few times really close to the wall, you can take a small step forward and basically just exaggerate that movement. So those knees are staying soft, we're not keeping them locked out, and those hips are translating backwards. So do a couple more reps for us. All you're trying to do with this drill is just kiss the wall back behind you with those hips, because what that's going to do in real life, if we step away from the wall and go to bend forward like you're going to grab something off the ground, is now more of that load is in the back of the hips and not that low back. So I'll demonstrate bending forward. So a lot of times when people bend forward, when they don't push those hips back and they let those knees lock out, now my low back is kind of like a crane, and there's a lot more torque on that low back. So if you can imagine, if I'm dealing with a low back injury, bending this way is going to be way more nice to that low back than bending forward, keeping those hips still, not really bending those knees. So again, this is just a drill, so it's not necessarily something you really have to focus on sets and reps. But if you're dealing with some low back pain and you're trying to figure out how can I bend forward to do tasks, pick something up off the ground, doing some hip hinging, so show us a few more reps, is a really great way to do that. So letting those hips shift backwards, letting those knees be nice and soft. And you can even, another cue I give folks is let those hands kind of slide down the front of the thighs. The hand should be kind of close to our body with this drill. If you're bending forward and those hips aren't translating backwards, a lot of times what you'll see is those hands naturally dangle kind of way out in front of us. If you're pushing those hips back, naturally those hands should stay kind of close to our body, right? So again, hip hinging, great drill, especially if you're dealing with some low back pain that gets worse with bending forward. A great way to try to bend forward to grab things throughout our normal life. So give this one a shot.